7 o'clock. Great. Thank you, Lois.
I got you covered.
You may want to put yourself on mute. You know your fan issue.
I will.
Okay. All right, folks, I have 7:01, so I'm going to go ahead and get started. I want to thank everybody for joining us. This is one of 3 EVV public forums that we are doing this week. My name is Brian Dowd, that's D-O-W-D. I am the Deputy Executive Director over Policy and Auditing at the Department of Community Health. And I am the business owner, and I have been working with the EVV project, electronic visit verification, for the last 3 years or so. We always start all of our presentations with the mission of the Georgia Community Health, which is to provide Georgians with access to affordable quality health care through effective planning, purchase, and oversight. Just a brief outline of what we're going to be going over today. You're not going to hear a lot from me because I think I've done enough town hall meetings that you guys are probably tired of hearing from me. We've done an awful lot of these town hall meetings associated with EVV. We did them throughout the state. We did 2 very big ones in the metro area a little more than a year ago, just to kind of prep the waters, let people know where we were going. And so we'd really like to move, now that we have a vendor on board, to implementation phase. But before we did that, we certainly wanted to give you just a very brief overview again. And then at the end, we will break for a little bit of a quick Q&A session and provide you all the platforms for which we're communicating and ways to get in touch with us. And I do want to say one other thing before we get started. These are not the only EV presentations by any stretch of the imagination. We will have meetings and town hall meetings on multiple aspects of EVV. Everything from scheduling to consumer-directed services to claims processing. So there will be multiple trainings and town halls between now and when we get into our pilot and go live phase. So we always get asked, why EVV? Why are you doing an electronic visit verification? And the simple answer to that is because it's mandated by the 21st Century Cures Act. Originally, we were mandated to go live January 1st, 2019. We did get a good faith exemption in this state that allowed us to go through to June 1st, 2021. And then home health care services, we've gotten an awful lot of questions about this week. Home health care services go live January 1st, 2023. What goes live as of next year is personal care services, or what in the now and comp waivers we call community living services. So those are the services in the upcoming year. And we'll go over that more in just a minute. The good faith exemption allowed us to extend out the period of time till January to implement, as long as we were making a good faith effort to get there with EVV, allowed us to extend it out to January. We're not going to hit the January 1st, 2021 timeframe. We hope to, we'll go over the schedule a little bit later of when we hope to implement. But there are about half the states, it's more like a 20-30 split, that are going to be implementing around the same time as us. There's 30 states that hope to be implemented by December 31st with EVV fully in their states. And that's according to CMS, a recent meeting we had with CMS. but we will be moving forward in a very thoughtful manner to try and implement as soon as possible. And we'll give you that time frame a little later in the presentation. So I get a lot of questions around why are we doing EVV and why would we do EVV? And for me, the big reasons that I like to focus on doing EVV is because I think it can greatly improve access, quality of care, and health outcomes for Medicaid members. When you work at the Department of Community Health and in the waivers for a while, one of the biggest complaints you get is about aides not showing up, or aides being late, or aides who do personal care services missing days, a lot of missing days, and a lot of coming and having to leave early. So from an agency standpoint, this provides providers with a greater window in what to do, what their workers are doing, verify that service were rendered, reduce billing errors. It also helps with things like if a personal assistant comes to somebody's house and that person is in the hospital, it gives immediate notification to the agency and to the Department of Community Health that that person is in the home. And why is that important? Very frequently, post-hospitalizations or events, there needs to be a change in the person's plan of care in order to adequately address their needs. And we frequently find out about that many months later, whereas now we're going to have that information immediately. And then, of course, there is the main objective of why EVV, which was to reduce Medicaid fraud, waste, and abuse. So what is EVV? Shell, it's a computer-based system that does electronic data capturing, near real-time, GPS located. It can be used both urban and rural, and has different methods for doing it. And it's able to transmit not only billing information, but at a minimum, these things that are on the right: type of service performed, individual receiving the service, date of the service, location of the service, individual providing service, and precise time the service begins and ends. It was interesting. I was recently talking to a friend of mine about EVV, and they were expressing to me they had recently had some work done at their house, and the service worker who had come to their house had an EVV. They were asked to check in when that worker came to their house for the company that they worked for. They did the work in the person's house, and when they left, there was a list of tasks that they had done, and they pressed the button verifying that those tasks had been done, and that person left. He was like, that sounds like an EVV to me. I was like, that's exactly an EVV. So the EVVs are, we're also committed in the state of Georgia to an open model for EVV. So what that means is, because it's kind of confusing, what that means is we have selected a vendor in the state, and that vendor of the EVV system is TELUS, and they work along with a company called Conduit, and you'll hear from them both, and they'll explain that relationship. They have a system that providers can use, and those providers can use that system at no cost, no direct cost to use it. You will have to train your staff, of course, but there is no cost to the provider to have it. But we also recognize that many providers out there already have their own EVV systems. They saw the value in this a year ago or 2 years ago. We don't want those providers to scrap their system if they're really happy with it. So we allow them to use their system, and we will aggregate to their system as long as it meets the requirements and it has a manual entry option. I like to always talk about who.
Hey, Brian?
Yeah.
Can you give me 1 second, please? I'm getting messages that some certain people can't hear the presentation.
Okay.
So before you dive in, I just wanted to try to assist with the audio, because I've got 2 people that said they're muted, but they can't hear. Joe, I know you're out there and you're not a panelist. Are you able to hear?
Yes, I'm able to hear Brian just fine.
So what we had happen in the presentation we had a presentation that had close to 300 people on it. And there were a couple of people who had connectivity issues associated with that. So you may be having connectivity issues on your own.
Okay, one person that said they couldn't hear, they said that they can hear now. I didn't do anything different, Arnisha. So I'm glad you're able to hear. And I see a Clementine Rivers. I know you said you can't hear either. If you could confirm.
It may be a connectivity issue on there, Chloe. So what we'll have to do is we'll have to keep going.
Yeah.
And there is another presentation tomorrow, and I'll give you multiple resources for where you can get in contact with us.
Yeah, and then we'll be posting this presentation as well on the site, everyone. So those of you guys who cannot hear, certainly welcome to go to our EVV website and listen to the presentation there. Okay, sorry, Brian. Yes, go ahead.
So I always like to go over who will be impacted by EVV. So this is really specific. So we wanted to make it, because we're posting this like Lee Clovis said, we wanted to make it as specific as possible. So the impacted Medicaid programs are our 1915C waiver program, our home and community-based waivers. You will know them as the new options waiver or NOW waiver, comprehensive supports waiver, COMP waiver, the independent care waiver program or ICWP waiver, the elderly and disabled waiver, which is frequently thought of as SOURCE and CCSP, and the Georgia Pediatric Program, which is not a waiver, but is in-home skilled services for children that does also include personal supports. The workers may be any of these workers you see down here that are supporting these specific services. May be called community living supports. It may be called personal support services or personal care support. And that does also include consumer-directed services. CMS was very clear that consumer-directed services was included. And again, home health will not be until January 1st, 2023. And we do have a list of who is not impacted. We won't go over that today. But it will be a part of this presentation. We have an Appendix B, just so you have that information as well. I have gotten a tremendous amount of questions this week about how this impacts case management and support coordination. So the easiest way for me to explain how it impacts them is this is another tool in case management and support coordinators' toolbox. So just like every service that is added and every tool that is added to help case management or support coordinators coordinate educational, social, medical, and other needed resources for members, this will do that as well. As I stated early, it may provide a really good window into if somebody has been hospitalized and their plan of care needs to be updated so they receive more hours. It may provide a really good window into if they have a member who is brokered for 45 hours of personal support every week and they're using 3 hours a week for 10 weeks. Your plan of care obviously there needs to be amended because you've brokered a lot of hours that aren't being used, or vice versa. If there are requests for more hours that are being needed than what's in your plan of care, and you're consistently using every single hour, then that's something case management will want to look at. So I believe this is where I stop. I have to check my list. So I'm going to turn over the presentation now to Orlana. She is with Conduit, and she is going to go over the rest of not the rest of the presentation, but give you some specifics about the system itself. And I'll control your slides for you.
All right. Thank you so much, Brian, for that great intro. Good evening, everyone. My name is Irlun Germain, Senior Project Manager representing Conduit and TELUS tonight. So next slide, please, Brian. Next slide. All right. So we are going into the technology portion of the presentation tonight. So with this particular slide, we are introducing TELUS and Conduent, and we are very experienced in the health and human services space. As you can see, 49 years of experience, 20 years experience with EVV. We have implemented EVV in various other states. And also we've implemented EVV with managed care organizations. And we have thousands of providers already using our EVV solution. Next slide, please. All right, so I know you're hearing the names Conduent and TELUS and wondering what's the difference between the two. Conduent is serving as the prime contractor for the EVV implementation. Conduent will play the role of doing the project management, the quality assurance for the entire implementation, as well as the customer support. So once we go live and the providers are calling in for assistance, you will be calling into Conduent to help with any matters that you have concerning EVV. As far as TELUS will be serving as the subcontractor, and TELUS actually provides the technology, the actual EVV solution. TELUS will also be doing the training and the outreach. Thank you, Brian. All right, so getting into the technology, one thing I do want to let all of you know is that as we do the town halls, we actually will be doing more demonstrations. So you will get a feel and a snapshot of the technology at a much deeper level. Today's town hall is just to give you an introduction. So as far as this slide is concerned, the TELUS EVV solution has two main components. We have the mobile application and the admin portal or the administrative console. So as far as the mobile application, it's just like any other application on your smartphone. So once you download it, you will be able to create visits and complete your visits on the mobile application. And as far as those that would use the mobile, there you go. As far as those that will use the mobile application, it would be the providers, caregivers, the aides, those out in the field actually performing the care and the services. Those will be the ones using the mobile application. I know we've had questions as to whether or not the mobile application can be used on a computer, but actually it's only to be used on a smart device or a mobile phone. As far as the administrative portal, this is where you would complete your billing, and this is where you would schedule your visits. And the users of that system would be fiscal agents, provider administrators, the agencies, case managers, billers, so someone in an administrative capacity. Next slide, please. All right, so this is a snapshot of the home page of the administrative portal. This is actually exactly what you would see once you log in. One of the things that we pride ourselves in is the simplicity of the homepage and the actual application. So as you can see here, the colored boxes actually give you a real-time feel of what is going on with your employees or the providers and the caregivers out in the field. So as an administrator, once you log into the mobile application, you can actually see in real time what's happening. So for instance, the orange box where it says not started late, it shows that there are 5 scheduled visits that have not started. So you would actually be able to call your aides and figure out exactly why they have not started those visits that were scheduled for that day. So the first bullet point talks about the real-time dashboard. Again, you would be able to do your scheduling within the administrative portal. You would also do what we call visit maintenance. And then we're actually receiving an electronic feed of all of your prior authorizations into the TELUS system from DCH. So you'll see an electronic view of your PAs within the administrative portal. This is also the tool that you would use to do your billing and your claim submissions. And then we also have a cool feature for provider messaging, which means that the administrator or the biller can actually send messages to the caregivers, providers, and the aides out in the field. So if they have an important message that they want to convey to anyone out in the field, they can actually do that directly from the administrative portal. And it is a HIPAA secure way of messaging instead of using text messaging. And it's two-way communication, which means that the actual caregiver can send messages back to the administrator as well. And then the last 2 points, the participant profiles and actual provider profiles. So all of the data on the participants and the providers are also electronically sent from DCH into the TELUS system. Next slide, please. All right, now we have a slide that really talks about the mobile application. And as far as the mobile application, as I mentioned before, it works on smartphones and tablets, not to be used on the mobile application on your actual computer. You can download the application just like any other application on Google Play or the Apple Store. The next 2 bullets really talk about a lot of questions that we typically get concerning EVV. So one of the questions we commonly get is, what about if I am in an area that does not have cellular service or connectivity? The good news is we have a feature called offline mode. What this means is that as long as you have scheduled a visit prior to getting into the area that does not have cellular service, meaning your administrator has scheduled the visit ahead of time, or when you have cellular connection, you've scheduled the visit on your mobile phone. Once you reach the location that no longer has cellular service, you still have the option to clock in and clock out in offline mode. Once you receive connectivity again, the application will recognize that you are now connected to Wi-Fi, and then it will take the data and transmit it to TELUS. So you don't have to worry about not being able to clock in and clock out when you do not have Wi-Fi. The last bullet point touches on an important topic, which is privacy, and DCH and both TELUS and Conduent do respect your privacy. And saying that we do want to emphasize that we do not track you when you're using the EVV technology. The system is designed to take a snapshot of your GPS location at the start of the visit and then at the end. We are not tracking you before the visit, during the visit, at the end of the visit. It only takes a snapshot when you clock in and clock out. Next slide, please. All right, so with this slide, it's basically depicting the ease of use of the app. The application, again, is designed to be very user-friendly and easy to use. So in 5 steps, you're really basically completing the visit from start to end. The first view of the mobile app shows the calendar, and this is basically your schedule. So whatever visits you have scheduled for that day will appear on your mobile app. When you get to the member's home, you'll see the visit. You'll select the one that you would like to start. The next photo is showing your check-in details. Basically, it shows the day, the time, the actual task that you're there to render to the member, and the services. And as you can see, there are bright colored buttons for you to go ahead and select the services. We have red to start and green to start and red to end. And so once you hit the green button, you're actually starting the visit, and you can put your mobile phone down and render the service. And once you're done rendering the services, it takes you to the third photo, which is the check off screen. This is basically going to give you a summary of the services that you've performed. And it is going to list all the tasks that you were scheduled for that day. So for instance, on this screen, there are 2 tasks, cleaning and cooking. So for instance, if you did not complete one of the tasks, you would just uncheck the button and verify that you've only completed that one task. The next photo is the actual signature capture and the checkout. And then the last screen basically confirms that you've completed your visit. So 5 easy steps. All right, so I know we've had questions on what if I do not want to use TELUS, or what if I'm already using EVV, what are my options? So TELUS as the aggregator actually will integrate with other third-party vendors in the state of Georgia. The provider and the vendor will have to submit documentation. It's called a third-party attestation, basically certifying that you meet the requirements of DCH as well as the Cures Act. Once that paperwork has been signed, the third-party vendors will integrate with TELUS. But to get the process started, you as the provider will have to contact your EVV vendor and have them start the integration process by contacting integrations@fortelus.com. That is the email address that you see at the bottom of the screen. So you may want to jot that down, contact your vendor if you are using an alternate solution. Next slide, please. All right, so as Brian stated, Georgia has an open model, which means that you can choose any EVV vendor that you would like. So your 2 choices are to use the DCH system or the alternate system. The DCH system is obviously TELUS, and it is free of charge, so the state is basically footing the bill. And the alternate solution, also known as a third-party vendor or an alternate EVV solution, as long as that EVV vendor meets the DCH specifications and integrates with TELUS, you can use that system. But any cost associated with using that third-party EVV system is the responsibility of the provider. Next slide, please. All right. So we did conduct a survey last week, and I believe the survey was still running this week, and we had an overwhelming response from the provider community. So we thank you guys so much for your participation in that survey. And in the data collection, we did see that many of you guys are already using EVV. These were the EVV vendors that we were able to gather from the survey results. If you are using one of these vendors, or if you do not see your vendor represented here, you will have to have your vendor, as I stated before, contact our integrations team at integrations@fortelus.com. What that means is that once your vendor integrates with TELUS, they will send all your EVV data to TELUS, and then you will use the administrative console only to submit your claims and do your billing through TELUS, and those claims will be sent to DCH for payment. There is going to be tons more information on third-party vendors. What we plan to do is in future town halls is to give you a status update on where we are with each of the vendors and let you know who's contacted us, who has moved into the different phases of the integration. Next slide, please.
I think I take back over now.
Yeah, I think that's it, Brian. So back over to you.
I just want to thank you so much for that information. It's very helpful. So I'm just going to briefly go over a few more things, and then we'll open up for a few question and answers. I promised you that we would go over the project timelines, and this is our project timeline. We will have many, many more informative webinars between now and 2/17/2021. We do expect the training to begin on 2/17/2001, which is training very much hands-on for how to use the system. We want the system, our goal is to have the system in production 4/1/2021. That means it will be up and fully running, but we will start with the pilot phase on 4/1/2021. We're going to use a few providers to start with just to work out any kinks that might happen between April 1st and then mid-May. And about mid-May, we're going to go to a soft launch for all providers. And that will give our providers a good 6 weeks period to really use the system, figure out the system, make sure everything is okay with the system before we go to the full implementation 7/1/2021, meaning that we will expect everyone to be using the system and for the claims processing to be working between EVV and the Medicaid Management Information System, which is Gainwell, formerly DXC, that pays those Medicaid claims. So I'm going to give you just an overview of how we're going to communicate to you ongoing, and you're going to say this twice, and we're going to do the questions in just a minute, not right now, but give me just a minute. But I just want to start with you knowing about our dedicated EVV mailbox, and that is at evv.medicaid, the word Medicaid spelled out, at dch.ga.gov. That comes to us. It actually comes directly to me most of the time, and then I respond to the questions. Not just me, other people respond to the questions. But we monitor the email box on a daily basis. We try and get back to you within 48 hours. There was a period of time where I wasn't doing that very well, but I am doing it right now. If you're like me and you think about questions later, or you just don't like putting questions in a chat box, that's fine. Send them to us. I know some people like to have an individualized response, and we will respond to you. If you need to talk to somebody, we will schedule time to talk to you as well, if you're more comfortable conversing and not typing. I was thrilled after our presentation we had a couple of days ago, where we had, I think, close to 300 people on. We had some really thoughtful member questions that came into our mailbox as well. So I encourage you not to hesitate in writing the EVV mailbox. So, but there will be other ways we have an Office of Change Management team, an organizational change management team that we are working with. It's helping us with all kinds of different ways to communicate with everyone. Readiness survey, call campaign. There's been tons of invitations that go out to a listserv we have. We have a website that you can look. We are putting everything on banner messages. We are really trying to get the word out every way we can. We are doing trainings that will be coming on accessing and requirements. We're going to do member and provider trainings, including consumer directed. We have public forums like this one. We're going to be doing stakeholder meetings. We have social messaging. And of course, one of the main ways we meet and speak with our provider community is banner messages. We have the website, which I told you about, and this is a link to it. You can also just very, very clearly, if you go into Google and put in DCH, GA, EVV, it will be the first thing that pops up. Probably if you put in GA, EVV, it's going to be the first thing that pops up is this website. We're publishing all of our PowerPoints. I know that was a big question. Will we have access to these slides? Yes, we're being as transparent as possible. There are no gotchas in this process. So everything that we know, you're going to know. We plan on doing flyers and announcements. I talked about the surveys. We're doing FAQs and quick reference guides as well. We do have, like I said, the town halls this week. We had one a couple of days ago tonight so we could have a little bit of an alternate schedule. I know it's a little less than normal, but that's okay. And then we have another presentation tomorrow in the afternoon that's got several hundred people signed up for it. We will also be going to all the associations for providers, whether it be SPAD, or Gossip, or Leading Age, or AAA meetings, any meetings we can go to really speak about and move through this process, we're going to be doing that as well. So our next steps will be getting in aggregator data that we talked about, making sure that folks are using that website to communicate to TELUS and Conduit of existing systems they have, providing training, providing webinars. And our goal here is really to ensure minimal impact to Medicaid members, first and foremost, and then providers as well. We want this to be of value to members and providers and to increase quality of care for our members. Now, finally, we have a Facebook page, if you didn't know that, because about 1.5 years ago, I didn't know that. It wasn't that long ago I learned we had Twitter, because I don't do the Twitter thing, but we have a Twitter if you feel like tweeting. We also have a YouTube channel, and we do a blog and news feed. So all of these are places and avenues we are leveraging to get the word out about EV. Okay, so again, I'm going to stop here and just re-emphasize the EVV website that you can specifically send in questions. But I do want to thank you for your time tonight, because I know it's in the evening and I know it's normally probably time that you're doing things at your house. So we appreciate that you took the opportunity to spend a little bit of time with us. I'm going to pause here and see if either Catherine Ivy or Lee Clois has questions that we can hopefully answer.
Hi, Brian. It's Lee Clois. I do have just only a handful of questions that were submitted. All right, so first question, can you confirm if applied behavior analysis services fall into one of the categories of services that will be going live in 2021?
So ASD therapy is what the service is that we have in the state of Georgia, which is autism spectrum disorder therapy, and it is not included with EVV.
All right, and a follow-up question. What about specialized family care?
Specialized family care is a service that we have. We have a service called structured family caregiving. And that's a different service than personal care support too. So it's not included in EVV.
Okay. Another question. As a case manager, would we be able to use the admin portal to set up alerts if a visit does not start on time?
Well, I think we're mainly going to, go ahead. Sorry. Was somebody else speaking? I think our goal is for the EVV admin to be informational for case managers. But that may be something we discuss through the design process.
All right, this may be one for Erland. If our third-party vendor has already developed integration with TELUS, are there additional steps we have to take as the provider?
Yes, even if a third-party vendor has already integrated with TELUS in another state, there may be certain changes that they will have to make to their existing configuration with TELUS. So you will still have to contact your vendor and let them know that they need to integrate with TELUS for the state of Georgia.
Okay, thanks, Erland. Another question, will we be required to bill through this system?
Yes, billing for personal support systems will go through EVV.
Okay. Will we still have our fiscal agent?
Yes, you will still have your fiscal agent. Your fiscal agent, we will be treating as a provider with their own EVV system.
Okay. ASD, is it not included at all or just not in the 2021 go live? What about 2023?
2023 is for home health. And it is not indicated within as part of the Cures Act that autism spectrum disorder therapy services be included. So at this point, we don't have plans to do it. I can't tell you what's going to happen in the future. Many states who have implemented the EVV system have expanded their EVV system to larger than personal supports. No plans on doing that right now, but I can't tell you what we might do in the future because that's above me.
Okay. Another one. I presently send in timesheets via fax. How long can I continue to do this?
So I'm assuming that question is associated with consumer-directed services. And that's a broad enough question that I'll be able to answer it. But I want to encourage people on the presentation not to go too far into your own personal circumstances. If you do have those, go ahead and email them to me, just because I'm super hypersensitive of PHI, and I don't want, there isn't a participant list and everything else. I really don't want any PHI issues or anything else. So if you're currently faxing in your timesheets, we'll be working with you and your fiscal intermediary between now and the July 1st hard implementation date to move over to a much easier and administratively simpler EVV solution.
Okay, and thanks, Brian. Another question, can you briefly describe how this may work for consumer direction?
Like I said, I think it's best we hold on that question because we're going to be doing specific and targeted webinars and trainings that are associated with consumer direction. Again, with our whole understanding that we want to minimize impact to members as much as possible. So if you're thinking in terms of one of our fiscal intermediaries who has an EVV now, if it was like another provider, you would just continue to use that EVV system, and then it would communicate with the TELUS system, assuming it meets all of our requirements.
Okay. All right, Brian, we do have one that's a scenario, and I think scenarios like this would be a good idea to add to our frequently asked questions. And I'll state the scenario, but we can, of course, add these type of scenarios in different scenarios as well. This question is, does the employee have to log in and out precisely? For example, they arrive at 8:20, but the shift begins at 8:30 and ends at 5:30. Do they have to log in exact hours and times down to the minute?
Well, they should log in when the service starts, and they should log out when the service ends. That's what they should do, because the service, the clock in and clock out is associated with your prior authorization for service and your plan of care. So it's all connected. So you want to report the time that you are actually providing the service, because that's all we pay for in Medicaid. We pay for the time that you're providing the service. So if somebody's early and they're not coming in and doing service, then they wouldn't clock in 10 minutes early. But the system is flexible that it doesn't have to be so rigid that it's like, okay, you can only clock in at 8:30 and no other time.
Okay. I believe several of the other questions that are on hand are a little bit more specific, not so much general, but I do have one last one that is general, and it's just, Brian, if you would just repeat the dates. When does mandatory adherence to this electronic filing begin?
We expect all providers to be up and using the system 7/1/2021. That's fully implemented. We will be up and ready with the pilot period April 1st, 2021. And in mid-May, we will go to a soft launch, which means that individuals will be able to use the system and test out the system between mid-May and the full implementation launch in July.
Okay, thanks, Brian. And did you address if specialized family care?
Again, specialized family care isn't a service that we provide family caregiving in. So yeah, I addressed that.
Okay, I think everything else we can capture and add to the FAQs.
Again, if you had specific scenarios that we did not address, I want to encourage you very much this website, this email address, and email it to us. We will respond to your email specifically, so you have it and then you have it in writing, right? So please go ahead and do that if there's any questions you have or questions you have tomorrow or otherwise. Okay, I want to thank everybody for coming here on the evening night. Really appreciate your time, and we will post this presentation so everybody has a copy of it. Thank you, and have a good night, everyone.
Thanks, Brian. Thanks, Erland.